My name's Louise Woodward. I'm a paediatrician working in Darwin. I've been working on the health impacts of the oil and gas industry for the people living around gas extraction and production. In particular, my hometown of Darwin is the home to two of the largest LNG plants in Australia, run by Santos and Inpex, and they have just started fracking the Beetaloo Basin in the Northern Territory. I got into this advocacy work because 2 years ago the Northern Territory government greenlit fracking the Beetaloo Basin in the midst of a climate crisis, and they did that despite knowing the health risks. And I thought, this is not right, and I needed to use my skills as a paediatrician and a health professional to actually speak out in the media about the health impacts of these gas projects on the local populations. It can be really difficult for doctors in particular working in the public health system to speak out about things like fossil fuels and fossil fuel projects, because a lot of these projects are supported by the governments that they work for. And I've been very lucky in the Northern Territory that I have been able to speak speak out about these projects, because I have been speaking the truth. I've been raising awareness about pollution, and that is actually really helpful for the health department to know. And it's really helpful to plan mitigation and to actually improve our laws that govern air pollution. Unfortunately, in Darwin, the fossil fuel industry has continued to expand, and we have had a number of scandals brought to light over the last couple of months. One of which being the Santos LNG plant has had a leaking LNG tank that has been leaking really since 2006, and the public were not aware of this. This is really harmful to human health, particularly children, because the gas that is escaping from the tank contributes to air pollution. Unfortunately, just last week, Inpex, the other LNG producer, has been found to have underreported its cancer-causing benzene emissions by 130 times. I've been speaking about the dangers of their toxic pollution emissions for a couple of years now, but I've been talking about the amounts that they were underreporting. Now I've found out actually I was wrong, and the pollution levels were 130 times more than I thought, and it really makes my blood run cold actually, to think of the risk that the people of Darwin have been put through by these companies not doing the right thing, but also our government not regulating them properly. The Northern Territory EPA should be the regulator who holds these companies to account, but Santos is allowed to use a leaking gas tank. Inpex is allowed to continue to pollute with impunity, and this really has to stop. And I think public health and health professionals speaking to the public health risk really is the key moving forward.
Is there anybody else who can come in and do that regulation, for example, the federal government?
So I think the federal government is key here. Amazingly, there is no federal regulation of air pollution in this country, which astounds me. And there really needs to be something like a Clean Air Act, which they have in a number of other countries. A Clean Air Act federally would actually force the state EPAs to take their responsibilities seriously and limit the emissions of these harmful pollutants from these companies. That would actually improve the health of the populations living around these LNG plants, and it would also improve our climate.
Louise, could you just spell out the risks of these industries, particularly for children?
Yeah, so the risk of these toxic pollutants from the gas industry to children are really severe. The pollutants enter our bodies through our lungs and really cause inflammation throughout. So they've done some big ecological studies from around the world, and the research is becoming stronger and stronger. We know that populations living near fracking sites and gas production have higher rates of childhood leukemia. They have higher rates of stillbirth, higher rates of preterm delivery, higher rates of congenital anomalies for babies, particularly congenital heart defects. That's particularly bad in Darwin because we don't have any cardiac surgical centre. There's also higher rates of a number of other types of cancer, particularly blood cancers, but also cancers of the head and neck. And we know that oil and gas workers have higher rates of bladder cancer as well. And what I worry about is, the pollutants like benzene are a known carcinogen. That means we know it causes cancer, and there is really no safe limit of benzene. So I worry about the people that have lived in Darwin for a period of time, and then they leave Darwin and they move elsewhere in Australia, and they get early onset cancer, and we won't know why, but it's a real risk for the people, and it remains a risk throughout their life after you've been exposed to benzene. And so these companies should be taking their emissions of benzene and other pollutants like it seriously. They should be making a really, really strong effort to reduce the emissions of these chemicals, but the government should force them to as well, and should hold them to account. Now, both Santos and INPEX need to be held to account by the government, by the federal government. If the Northern Territory government won't do it, the federal government needs to step in and do it. They need to force Santos to fix their leak, and they need to force INPEX to reduce their toxic emissions.
And just on the evidence around the health impacts, are you seeing that evidence reflected in your own practice?
It's a really interesting question. Do I see the health impacts in children in my practice now? Anecdotally, I can say yes, I'm seeing more severe cases of asthma coming into Royal Darwin Hospital. I'm seeing more cases of allergies and sinusitis. Can I say that is due to the gas industry? I can't. But since the gas industry arrived, I know that the air pollution is worse, and I know that the health of our community is worse. Now, I can't say that is directly because of that company or this company, but I know that the research tells us that the health outcomes for communities living near gas plants is worse. In fact, there was a big study in the US that shows a higher all-cause mortality for people living near gas plants. And that's probably because when you have chronic disease and you live near a gas plant, you're much more likely to die of your heart disease, or die of your kidney disease, or die of your diabetes. And so, this is, it's a real justice issue as well as a public health issue.
You've made calls to action to the state and federal governments. What about the public health sector?
Yeah, so the public health sector has been really supportive with this issue. So Public Health Association of Australia and the Climate and Health Alliance, there's quite a number of public health organisations that have been incredibly supportive. There are, quite a number of public health physicians that are watching this space and are acting as well. And I think it's going to be really important for health professionals of all stripes in public health, but also other specialties, to come together to inform our community, which can then force the government to do the right thing. At the moment, I think the government is more afraid of gas companies than they are of the voting public, and we need to change that.